So, hello, everyone. Good afternoon from here on the East Coast. I'm Michael Goldberg, who is the scholar in residence at the Schwartz Center for Compassionate Healthcare. I want to welcome everyone to the 2023 virtual Compassion in Action Healthcare Conference. Thank you for joining our presentation. Best practices for successful well-being programs to support healthcare workers. Please allow me to welcome our speaker, Bridget Birkeland, who is the manager of employee well-being at Mayo Clinic in Rochester, Minnesota, and an assistant professor of healthcare administration and a national board certified health and wellness coach. Welcome, Bridget. We are very happy to have you with us today, and we look forward to hearing about your work. And so I'll pass it off to you.
Great. Thank you so much, Dr. Goldberg. And thank you to everyone here for this session. I look forward to discussing best practices for successful well-being programs. And so just to get started, I do want to invite you to turn on your camera. This will be an opportunity to connect. And also throughout this session, you're invited to use the chat and the annotation tools to share your thoughts and best practices and lessons learned. This will be an opportunity to learn from one another. I like to live as a student myself, so I look forward to learning from you as well. So I invite you to select your annotation tools, either click on the pencil on your screen or go to the top of your screen under View Options, hit Annotate, and we'll be using the stamp and the text tool throughout today's session. And so just to get started, I invite you, stamp your location on the map. Stamp your location on the map. And again, if you click your annotation tools at the top, you should be able to select a stamp of your choice. Perfect. It's wonderful to see the different locations and organizations represented here, and yet to know what really brings us together is this common goal or desire to help healthcare workers to experience care, compassion, and well-being within our organization. So thank you for being here and sharing. And so I'd like to explore our story in this healthcare space. I'm going to share a little bit about my story, and I'll give you an opportunity share yours within the chat. So I've been at Mayo Clinic for 16 years, all in the well-being space, offering, leading, and creating well-being workshops, wellness coaching. So I invite you in the chat. Would you share your organization's name and how long have you worked there? So go to the chat, select everyone. What is your organization? Welcome from Seattle, 10 years, 10 years, 4 years. Wonderful to see a variety of different organizations, 23 years, 18 years, 3 years, 10 years, 18 years. So it's just a good time to reflect on all the different organizations that are represented here, and to also to think about whether you've been at your organization a few months or a few years. There are probably some common themes that we're both experiencing within our organizations that impact our well-being and or our stress. I thoroughly enjoy what I do at Mayo Clinic, helping well-being, helping colleagues to experience some well-being within their day. However, I have to say we are experiencing many challenges that impact employees' well-being. So I invite you in the chat, share what challenges at your organization are you seeing that impact employees' well-being? I can share one for sure is staffing issues impacting people's schedules and employees' well-being. What other challenges are you experiencing at your organization? So burnout, transition to a new model, no time to utilize resources available to them, adjusting after a merger, yes, violence against employees, post-COVID burnout, childcare options, funding for wellness programs. And as I'm reading these, you're probably not alone. There are probably others here that are experiencing those same issues, so we can have compassion for one another. And so, yes, we are going to look at best practices for successful well-being programs, but I also want to validate, as you have in the chat, that there are many challenges that we're facing that we might not have solutions to. So that's a little bit of my professional story. I'm also going to share a little bit about my personal story because it definitely has impacted my work with healthcare workers. So in November of 2017, winter in Minnesota, I'm in Rochester, Minnesota, we thought my husband, Dan, had a respiratory bug. And through a series of medical appointments, our lives went from normal to not so normal when he was actually diagnosed with stage 4 melanoma. And so our family was catapulted into the patient care world at Mayo Clinic. And that is where I got to see Mayo Clinic's values in action, such as compassion and excellence in their care for patients like my husband. So I invite you to share in the chat, what are your organization's values? Would love to see, what are your organization's values? In the chat, if you would share. Thank you. Patient-centered, patient-centered. Other organizational values. Serving all. Everyone matters. High reliable organization. Yeah, so it's so important to think about our values: compassion, collaboration, innovation, integrity, excellence. We have some similar ones there, innovation. So it's really good to think about our values within our organizations and how can well-being programs support and foster those values. It was through my husband's battle with cancer that it became evident to me that healthcare workers' care for my husband was a tremendous gift for our family. And to be honest, when I heard of Ken Schwartz's story, his battle with cancer, and how he had been positively impacted by his care team, and as a result, he wanted to give back to those healthcare workers, it really resonated with me. And so I have tremendous gratitude for Ken Schwartz and all the staff affiliated with Schwartz Center. So I just want to thank you for all of your hard work and dedication. To be transparent with my husband's story, in November of 2017, he was only given 3 months to live. However, due, I would say, to many answers to prayer and the compassionate and excellent care at Mayo Clinic, instead of 3 months, he ended up living 3 years and 8 months. And so each day past that 3-month mark was a tremendous gift to our family. And so have tremendous gratitude for healthcare workers. And I really say that that cancer journey defined my work with healthcare workers, because I got to see the compassionate and excellent care given to my husband. It defined my work, and that is to give compassionate and excellent care back to healthcare workers as an expression of my gratitude. And so I just invite you to reflect, what gives you meaning in your work? If you would select your annotation tools, so the pencil on the screen or in the chat, what gives you meaning in your work, if you wouldn't mind sharing? Easing suffering, thankful patience, teamwork and serving patients, helping others, caring for others. Yeah, what gives you meaning? Thank you for sharing. Walking with people through difficult times, supporting coworkers, teamwork and serving. Yeah, so just invite you, developing my staff and watching them succeed. So thank you within the chat or on the whiteboard using your text tool, just sharing. And this is just a good reflection, because it's hard work. It's hard work helping healthcare workers experience well-being when there's so many stressors within our healthcare environment. Here's another one: keeping patients in the center of all we do. Beautiful. So I thank you for sharing your why and meaning in your work as well. And so by the end of this session, you'll be able to identify best practices for successful well-being programs, also describe barriers to successful well-being programs to help healthcare workers, and throughout, you'll be able to share your best practices and learn from one another. And so objective 1, identify best practices. We're going to go over 4 areas, and within each of these, I'm going to share some of my favorite practices, and then you're going to have an opportunity through whiteboard and the chat to share your best practices at your organization as well. So when I think of the first best practice, employee-centric design, what I mean by that is capturing the voice of your employees so that they can co-create well-being programs to meet their needs. And so a few examples of best practices. Number 1, psychological safety to create a safe environment. As I read the Healing Healthcare Initiative, it further validated the importance of psychological safety to help our employees voice what they need. Also, throughout many sessions in this conference, this whole topic of psychologically safe spaces has come up to validate that importance. Trust and trustworthiness, so to build trust with healthcare workers and help them to be a part of the decision-making process. Inclusion, voice, and choice. So including healthcare workers in the decisions on what well-being programs we bring at our organization, and also what are their solutions and how can we implement. Other practices, listening to employees' voices to help co-create well-being programs. And lastly, what are the systems in place to collect employees' feedback? So I'll give you a recent example. I am actually meeting with colleagues that are members of diversity groups at Mayo Clinic to better understand their experience at Mayo Clinic, their sense of inclusion, what are the resources helping to foster inclusion and diversity, and where are the gaps in our resources? And where are there gaps? Are there some resources or programs that we can co-create to get into place to support them? And so I've shared a few of those best practices in this area of employee-centric design. And so I invite you in the chat or using the text tool on the screen, what else would you add to the list? What helps you capture the voice of your employees to create employee-centric well-being programs? We'd love to hear your ideas. So in the chat, what are things that you are doing or practices to create employee-centric well-being programs? Just curious, recently we also had all staff survey results, so that has been really helpful to kind of inform areas where there might be gaps in our programming as well. Anybody else want to share? Yep, thank you for your thoughts here. Feedback from employee survey results, provider wellness surveys, a nurse practice council. These are great ways to get feedback, to understand what our employees going through. In-person periodic check-ins to see where our providers are and what they need. So good. That's a great. Focus groups, very helpful. Stay interviews and seeing the trends. Health relationships between staff and leadership. Very important practice. So just invite you to think about what are those practices where you can capture the voice of employees, holding informal groups and asking what healthcare workers want and need. Beautiful example. Great, thank you for sharing. And I also want to add this one, town halls, leadership rounds, and other forums. Great. And I agree with all of your suggestions there, so thank you for adding to the list. I want to also give you another example of employee-centric design. So Mayo Clinic has approximately 78,000 employees, and there are clinics across the United States and even internationally. And we had a problem to solve, is that we did not have an enterprise-wide employee well-being strategy. And so through listening sessions and surveys, we asked our employees, what do you want to experience here at Mayo Clinic? From all of that data, we saw some key themes that helped to co-create our employee well-being strategy. And from the themes, develop 5 focus areas of well-being. What I'm going to do is I'm going to share those 5 focus areas with you. And if you resonate and you're like, yes, I definitely would like to experience that at work, I'll put a little stamp on that focus area. So Mayo Clinic employees stated that they want to experience a healthy work environment. They want to feel physical and psychological safety, workload challenges being addressed, and that employees understand the resources to help them be supported and to thrive. So if you resonate with that, put a stamp there. Employees want to experience personal enrichment. So even to think, do you want to feel connected to your organization's mission, grow in your career, and have the resources to support emotional, financial, physical, and mental health? Employees want to experience community at work. So a sense of belonging, culture, inclusion, and trust. A sense of being valued. I know in one of the sessions that I attended, the presenters shared that employees ask themselves, do I matter? What an important question. Do I matter? So employees want to feel valued and respected. And then lastly, employees want to experience meaningful work, meaning that their work that aligns with their skills, their strengths, and their values. And so based on the employee's voice, it helped to create these 5 focus areas and our new vision at Mayo Clinic for well-being. Mayo Clinic models a values-aligned culture. It was very evident that our employees really see our values as really important and foundational. And so our Mayo Clinic values, compassion being one of them, and to think about how are we integrating that into our wellness programs. So they want to experience a values-aligned culture where individuals have the support necessary to thrive and providing compassionate care and exceptional care, not only to patients, but for one another. And so this new well-being strategy has really helped us to assess our well-being programs and how do our well-being programs support our vision and these 5 focus areas, and where are there gaps in our well-being programs. And so in the middle of the 5 focus areas, what you're going to observe is that there is individuals, teams, leaders, and Mayo Clinic. From our listening sessions, what we heard is that employees want a shared responsibility model, meaning that it doesn't just fall all upon the individual, that they first see that it is a shared responsibility between the individuals, teams, leaders, and Mayo Clinic. So just to give you a few examples, in the area of a healthy work environment, at an individual level, what is an action step that I can do? I can show respect and compassion to colleagues to lay the foundation of a safe environment. At a team level, to foster community at work, I can take time at meetings to get to know colleagues through team building activities, something I'm working on at the beginning of meetings instead of diving into the agenda, just doing some team building activities. In addition, for each focus area, we have resources, well-being programs to support and foster that area. Some of the well-being programs that we offer are on-demand resources, virtual well-being coaching groups where a certified wellness coach meets with a small group of colleagues to connect them and to talk about well-being goals and also practice resiliency skills. We have virtual well-being workshops on a variety of topics, of course, Schwartz rounds, Wellbeing Champion program, which are positive influencers within a work unit, and they do well-being activities to foster well-being at that work unit level. And then we have the Healing the Emotional Lives of Peers, which is a peer support program. So colleagues are experiencing hard events at work, they can be connected with a peer supporter. In addition, we have Help EID, so to connect people with a peer supporter to foster inclusion and diversity. I'm not going to go through the specifics of each of these programs, but if you want more details, please reach out. What I am going to share with you are what are the best practices that I see within all of these programs to make them successful. And so the first is to look at people power. People power. And so people power practices. So a couple of the best practices, leadership support. Does the program have leadership support in funding? So Dr. Colin West is our medical director, and to have his support through quotes or attending meetings for our programs really helps programs to be successful. Is there enough FTE dedicated to not only launch the program, but also sustain it? I think about well-being programs much like an airplane on a runway. A few years ago, I was scheduled to leave Rochester, Minnesota on a flight, got a notification the plane was going to be delayed, and then there was a notification that the plane was not taking off because not all the crew arrived. And I thought about that. It's much like our well-being programs. If we don't have enough crew and staff, the plane or the well-being program never takes off, or the well-being program takes off, but there's not enough staff to sustain it. So something to think about. Collaborations, what collaborations are needed for success? So I'm going to share a few collaborations that have been key to successful well-being programs, but I invite you in the chat to share what are some collaborations that have helped your well-being programs to be successful. So for example, for our Help Peer Support program, Dr. Rivera and Robin Finney are the co-directors of the program, but the well-being team has come alongside them to help them to offer workshops to train peer supporters. We help with the promotion and the marketing. So that's an example of a collaborative effort for that program. Another one of my favorite collaborations is, of course, for our Schwartz rounds, working collaboratively with our chaplains, physicians, and other members of the planning committee. In addition, I've been really thinking about how the Schwartz rounds is a collaboration with our employees, because through the surveys, we capture the voice of our employees and what other topics would they like to hear about at Schwartz rounds. So that employee-centric design. So here are some of the topics. A patient I will never forget, processing how patients impact healthcare colleagues. When a patient becomes violent, bearing witness to death, remembering my why at Mayo Clinic. And also I thought this was appropriate for today's conference, is remembering moments of compassion in action. And so I had an opportunity to meet Heather, who was a panelist at that Schwartz rounds, and she gave me permission to share a little more about her story. At the Schwartz rounds, she had shared how she had come home from work, just entered into her house, and actually a huge garbage truck slid into the front of her house, and she was in the doorway when that happened. Thankfully, the truck did not hit her, but she was so startled that she ended up having some chest pain. And so she thought it was stress-induced, but after going to the hospital, it was actually heart failure. And so I'm just going to play you a little bit of Heather sharing her story from the Schwartz rounds.
Hi, my name's Heather, and I'd like to share with you my experience as a presenter during Schwartz rounds. My story started in February of this year. I was coming home from work, and a huge garbage truck let loose and came flying into my house within 30 seconds after I walked through my front door. I was less than 3 feet away from it at the time, and by the time I stood up from the impact, I wasn't really hit with any flying objects, but I stood up, I immediately started having chest pain. My history as a caregiver is 10 years as an ICU nurse in a cardiothoracic unit. And so I knew it was stress related at the moment. But later in the day, the chest pain just wasn't getting any better. And I decided to go in and get checked, and I did. And they said it was also stress related. And I went home. But later that evening, when we were in our hotel room, I really started to experience more symptoms, and I started vomiting. So my husband took me back into the emergency room where they started some fluids because my blood pressure was pretty low at the time. And shortly after they started the fluids, I started getting into some pulmonary edema and coughing up some frothy stuff. And the doctors really couldn't figure out what was wrong with me. But after doing some testing, and my troponins were in the 900s, they realized that I was in what they had thought was stress-induced heart failure, only to be diagnosed with it the next day in an echocardiogram. So I wound up getting admitted to the intensive care unit. But during my emergency room stay, as I was really crashing, I was trying to keep myself calm because I know what's next. That's the problem. And I had two nurses, one on each side, and the nurse to my right just kept stroking my forearm and saying, "Heather, you just keep doing what you're doing. You're doing great. You're doing great." Because I literally was in my head meditating a mantra that was, if Bridget could do this, I could do this. And little did they know that Bridget was one of my best friends. She had died of a glioblastoma only 2 weeks earlier, and we had just had her celebration of life. So I was in deep grief and really trying to connect with her. So I kept saying, if Bridget could do this, I can do this. And I remained calm. And the nurse stroking me helped keep me focused. And that was just an amazing sign of compassion. My second area of compassion was I was admitted to the intensive care unit that night. The doctor from the emergency room came to my room. I can still see him standing in my doorway, just saying, "How are you?" Just checking in, like taking the time out of his day to check in. He could have checked Epic, he could have called the floor and checked with them, but instead he came up to check with me. And that was intensely powerful sign of compassion for me. And then the third was just throughout my care of seeing different therapists from, all sorts of physical therapists, social therapists, my nurses, my doctors, everybody. When I would share stories, I would see tears well up in their eyes, or just them, and feel what I was feeling. And there is such love and compassion when you know somebody sees you, when somebody hears you, when somebody is really listening. That was just so incredibly powerful. And my team, oh my goodness, my team in hospice, which is where I work right now, was so amazing by reaching out, calling me, texting me, leaving me notes, sending me little gifts, just checking in while I was away, was so incredibly powerful in the way that they helped me ease back to work. I will forever be grateful for what they did for me in my time of need. And lastly, I'd like to share how powerful it was for me to share my story in the Schwartz rounds. To be able to share my story helped me in my healing journey, which is going to be for a while yet. So I appreciate this opportunity to share this with you, and I appreciate the opportunity to share it with our Schwartz rounds here at Mayo Clinic. Thank you.
So to think about her story, and I just loved Heather sharing even at the end, I was thinking about how Schwartz Rounds helps attendees, but it actually helps our panelists too through their healing process, quite powerful. And so just to show how an employee-centric program, the need of our healthcare workers to experience compassion and care, by offering that, how it also supports our overall well-being strategy. So based on our survey responders, 96% says Schwartz Rounds give me an opportunity to reflect on my well-being. So that helps to foster a healthy work environment at Mayo Clinic. 90% said attending Schwartz Rounds helps me feel supported in the challenges I face. So helping them with personal enrichment and growth to be resilient. 96% said diverse perspectives are welcomed at Schwartz Rounds. So fostering community at work. 96% that attending Schwartz Rounds makes me feel like my organization cares about me, so fostering being valued. And then lastly, 96% Schwartz Rounds gives me an opportunity to reflect on or connect on my meaning in work. In addition, qualitative data, key themes show how Schwartz Rounds foster one of our Mayo Clinic values, such as compassion, making colleagues feel like they're not alone, this sense of connection, fostering community at work, and also transparency is shared. So creating these psychologically safe spaces. I think for Mayo Clinic, the Schwartz Rounds is one of those well-being offerings or programs that is really helping change our culture. And what I mean by that is I observed when Schwartz Rounds started, it was really uncomfortable talking about the uncomfortable, and I see Schwartz Rounds as nudging the meter to make it a little more comfortable talking about the uncomfortable. So very grateful for the program. And so collaborations are key for success of our programs. Defining roles. So our roles and responsibilities defined. I don't know if you've ever experienced trying to launch and sustain a well-being program, and there's a large planning committee, but only maybe a few people are really actually doing the work. And so when I do lead well-being programs, it's really important to define everybody's role and responsibility and what is their value add, and really check in on everyone's part and contribution. Do the program leaders have the correct expertise and skills? So back to the analogy of the plane on the runway. Yes, you need appropriate FTE to launch and sustain a well-being program, but also if the crew on that plane are in the wrong places, the pilot, the co-pilot, the rest of the crew members, what I have seen with some well-being programs is that the plane will stay grounded or may take off and come back down. So just to kind of reevaluate, are all the right skill sets, expertise, are the crew in the right place to lead and launch your well-being programs? And sometimes it's an opportunity for reevaluation of each person's roles, or if there's gaps in skill sets, to create some collaborative efforts. Are the programs led by people who find the work meaningful? For me, I have to say, when I have an opportunity to help with Schwartz rounds or virtual workshops or offer wellness coaching, it's a part of my mission to give compassion and excellent care back to healthcare workers. It's very meaningful. And so I do check in with my team as well. Like, what are your favorites and most meaningful? What are your most meaningful programs that you're leading? It's so key that the people leading those efforts really find meaning in their work. And then lastly, it's hard work. It's hard work leading efforts to foster employee well-being within our organizations, especially with all the stressors happening within the healthcare environment. And so I think it's so important to celebrate the wins of our teams and our program leads. To be honest, I was on site pre-pandemic. During the pandemic, I moved to remote. Now I'm hybrid. Our team is remote. And so just really had to explore ways in our virtual world on how do we celebrate one another, and what are some traditions that we could have within our team to foster celebration and appreciation, to show value. And so I'm going to share one of our traditions when a colleague has a birthday or a work anniversary. One of our traditions is we'll just go around and share what I appreciate about you, ... and fill in the blank. And so I'm going to just share a brief clip. This is from Lindsay's birthday, of colleagues just sharing what they appreciate about her.
I wish you a happy birthday.
Lindsay, what I appreciate about you is your willingness to help others, and just how you may not always have the answers, but you're always a seeker and you go about trying to find solutions. So Lindsay, happy birthday.
Lindsay, what I appreciate most about you is just your love of learning, and also your willingness to take on new projects and just explore a variety of tools and technology that continuously enhances the work that we do and to support employees here at Mayo Clinic. So happy birthday. Thank you.
Happy birthday, Lindsay. A lot of people have stolen mine already, but what I appreciate about you is the fact that you are always my rock. I can always email you if I have questions, no matter how obscure they are, and you will find out the answers. So thank you for that.
So that's an example of one of our traditions, to celebrate our colleagues, their work with programs, and also to reflect on their strengths. In addition, I will share that we have a tradition of just taking pictures. I don't get to see my staff, so I take virtual pictures. And so we usually take a formal family picture, and then we have a kind of funny family photo just to kind of celebrate our colleagues. So I just invite you to even think about what are some of the things that you do to celebrate one another and celebrate the programs that you lead. And so I shared with you a few of these best practices under this area of people power. And I just invite you in the chat, what else would you add to this list, or on the screen, the whiteboard, select your text tool. What other practices help with people power? So I covered leadership support, having enough FTE, kind of like the plane, to make sure that the plane not only launches, but stays in flight. Collaborative efforts, making sure that the team leading the well-being programs has that expertise, defining roles and responsibilities. Are they part of meaningful work? Celebrating program leaders and their wins. What else would you add to that list to help with people power? And thank you for your comment. Love the tradition. Yes, it's been very helpful. Others, anything else that you find that helps to successfully lead well-being programs with the area of people power? Great. Oh, thank you. So steering to coordinate across many domains. So working with HR, R&R, wellness. So working across many domains and many different departments. And I agree, that has been really helpful. Fair living wage for work done. Often admin is not well compensated. So looking at compensation and roles. And so agree, reviewing data, then acting on it. That is so key. Yes, so thank you. Thank you for sharing. Wonderful. Okay. So best practice is effective program systems. So to think about the systems in place, I believe our well-being programs either rise or fall to the level of the systems in place. So a few of the best practices in this area of program systems. At meetings, having an agenda. I don't know if you've ever experienced being at a meeting, but it's the end of the meeting and nothing was accomplished. So having an agenda with defined goals. So a few of the things when I'm leading a program I find helpful is what is the schedule of the program in the upcoming quarter? So planning in advance, a quarter in advance. What is the timeline to promote programs? So giving about 4 to 6 weeks to promote certain programs. Otherwise, schedules are busy and people can't fit it in. What are the outcomes and metrics collected to evaluate success? Having a centralized website for resources, and this is an area at Mayo Clinic we're actually working on. We do have a website called Wellbeing Central, where colleagues can go to sign up for workshops and wellness coaching. However, we are working with other departments to make sure that their offerings is also represented on this website. Schedules are busy, so this can be a barrier with helping healthcare workers experience well-being at work. So having on-demand resources. So I'm just going to give you a few examples of our on-demand resources. So we offer a monthly well-being at work newsletter. We recently, this past year, I worked on a policy. People usually at employees had to opt in to receive the newsletter. And so just looking at the policy, could everyone receive it and just opt out? And so that was recently changed so everyone could receive this. At the top is a brief video, 5 minutes or under, on some type of well-being topic. On the other side is the quick tips, something they can read within a minute. And then you'll see this well-being like image. And this is an opportunity for colleagues actually to have a screen behind them in our virtual meetings, so that if I have it up, it might say, notice your gifts, practice gratitude, or take a moment to focus on your strengths. Healthcare workers' schedules are very busy. So to kind of dream about what are some well-being practices that could be integrated within their workday through their environment. So having these virtual backgrounds has been one of the ways. Another way to weave well-being into colleagues' workdays is screensavers. So during the pandemic, we're all sent home. We can't do like in-person workshops, and we were in a brainstorming session. And all of a sudden the idea came about, we all see screensavers throughout our day. So we've taken our well-being topics and put them on screensavers. So all of a sudden you see, again, a little reminder, extend compassion, extend kindness to yourself and others, or a reminder about our peer support program. Also thinking about the programs that are led, that when is the best time for your employees to be there? We do have sites across the United States, so different time zones. So just really getting the feedback of employees, when will these offerings be available so that staff can attend? Offering continuing education credits has been a great practice. User-friendly registration, attendance, and surveys, and then collecting those metrics to evaluate, reiterate, and publish. So I'm just going to give you an example of what this looks like. So we have our well-being programs already scheduled through first quarter 2024. Here's just a snapshot of some of them, everything from Schwartz rounds to our well-being champion program to virtual workshops to peer support. A colleague goes on our website, selects what they want to register for. It goes onto their calendar. They show up, attend, and then trying to end a little early in that workshop or offering so that we can actually have the survey integrated into that time to get their feedback versus sending out a separate email. We take all the metrics behind the scene, and that goes into our impact report that is sent to leadership. So that's a snapshot of our impact report, just highlighting the work of our virtual workshops, coaching groups, champion programs, Schwartz rounds. And so what I've shared with you are just a few of the best practices in this area of effective program systems. And I just invite you on the screen or on the chat, just share what are some other systems that you have in place that help your programs to be successful. I've shared with you having a centralized website, on-demand resources, making sure we know what time is best for colleagues to show up to certain well-being programs, having user-friendly registration and attendance, and surveys. Any other things you would add to the list? Another program system is offering during grand rounds has been helpful. So we integrated into physicians' schedules or nurses' schedules. We have self-affirmations posted in the staff bathroom that you cannot help but read. Having boundaries doesn't mean I'm weak. Having boundaries between work and home are vital. Oh, that's powerful. Thank you for sharing. Others communicate resources frequently, yes, and in multiple methods of communication. Very good. Transparency, share metrics as soon as possible together with leadership endorsed solutions. I use Outlook to invite staff to wellness events and classes using Outlook Calendar. That way I make it easier for all to attend. All they have to do is accept. Great example. Other examples here. Don't depend on email for communication. Yes, we can get overwhelmed with communication. So I do like the solution above where it states to make sure you're using multiple modes of communications. Leaders cover units and have viewing rooms so staff can participate in Schwartz rounds. That is a wonderful solution for busy staff. So thank you for sharing. Looking at communications and marketing, what are some of the best practices? So branding, we have this new employee wellbeing strategy. So we are currently working on making sure we're branding the 5 focus areas in all of our communications. Communications, I shared with you a few of the ways we communicate, the different communications vehicles. So website, newsletter, videos, screensavers, virtual backgrounds. The other thing I'll mention is e-cards. So we can send e-cards to colleagues, or we even have e-cards for our peer supporters to thank them or our champions. In addition, what are some of the collaborative efforts to help promote well-being resources? So a few ideas that we've implemented is to think about with human resources, partnering with human resources, all of the benefits. Well-being programs and resources are a part of benefits for our employees. So on the HR website, there's also information on employee well-being. Integrating into grand rounds has also been really helpful in promoting well-being programs. And the power of story, which was definitely a wonderful session here during this conference. The power of story, so capturing the story for our peer supporters or for our attendees for our workshops or our coaching groups. How have these coaching groups helped them with their well-being or fostered a sense of connection? And so these are a few examples of marketing communications. I invite you to share in the chat or on the screen, what are some of your best practices in this area of communications and marketing? At Mayo Clinic, we have also tried with our Schwartz rounds to put it on people's calendars, and that really helped too with attendance, that it was right on their calendar. They could just accept or decline. Great idea. Any other ideas that are helpful with communications and marketing? Simplify the message. Staff are overwhelmed with long messages. That's great feedback. Thank you for sharing. We interview caregivers and record a podcast regularly for staff. That is a wonderful example, a great practice, and an opportunity for staff to hear from the caregivers. Strong partnership with communications and marketing. Thank you for sharing. Marketing team with their active participation in program planning. So great partnership there. Thank you for sharing. Great. Okay. So objective 1 was to identify best practices for successful well-being programs. I went through employee-centric design, the importance of people power, having effective program systems, and communications and marketing. In addition, you had an opportunity to share your best practices in these areas as well. So I just invite you to reflect on a well-being program that you are either leading or you participated in that was successful, and use the stamp tool to stamp all the practices that really you think contribute to that program's success. What comes to mind for you? And I'll give you an example. Our virtual wellness coaching programs came as a result of listening sessions I conducted during the pandemic, where employees voiced they felt like disconnected, isolated, and wanted to work on their well-being habits. So it definitely was employee-centric design for our coaching groups. And we do have some certified coaches to meet in small groups with colleagues for these virtual well-being coaching groups. So I would definitely say employee-centric and FTR dedicated. What comes to mind for you? I find this kind of checklist helpful when I'm looking at a well-being program to better understand why it is successful. What are those key components to making it successful? I thank you for checking in. And next, what I'm going to invite you to do is think of a well-being program that might be struggling. You know, as we think of objective 2, you know, what describe the barriers to well-being programs. Really, it's the lack of being employee-centric design. I can share an example of that. During the pandemic, someone had the idea of offering virtual group coaching to physicians. So I created the registration page, we communicated it, and guess how many physicians signed up? I got 1. And it was by accident. He didn't know what he signed up for. So again, it wasn't employee-centric design. So there was a lack of that. It could be a lack of people power, a lack of effective systems, program systems, and a lack of communications and marketing. So I just invite you to think of a well-being program that's kind of struggling to be successful, and just stamp all the practices that are maybe missing, that are creating some barriers to your program being successful. What comes to mind? Also, at this time, we will put in the chat this checklist if you find it helpful. And thank you for checking in. And so there will be a checklist in the chat that has this list on as just a way, if you have programs that are successful, just to kind of look at, you know, why, what are the components, what are the best practices helping that program to be successful? And if by chance you have a well-being program that's been a little more challenging and is struggling, then you can go through the list and maybe identify what are those key best practices that are missing, and then also even think about what are some solutions to integrate those best practices. And so with that, I'd like to just close with a story. Throughout my husband's battle with cancer, I still have like these little snapshots of how Mayo Clinic colleagues have positively impacted my life. And I'm going to just share one of those snapshots from July of 2021. So in July of 2021, my husband was having seizures due to the cancer, and all of a sudden he couldn't talk. I'm not clinically trained, did not know it was expressive aphasia. I just knew he could not talk. And so went immediately to the emergency department. And during that time, of course, we went into this clinical room and all the staff were surrounding my husband and trying to stabilize him. I was just very stressed and panicked. And I remember a few times saying to the staff, you know, thank you for helping my husband. And all of a sudden, a physician turned around and said, you don't need to thank us. He extended his hand and he said, family takes care of family. You know, at that moment, compassion just swooped into my story. My stress went down because I knew that whatever happened, I'd be okay because my Mayo Clinic family would help me through, and they sure did. And I share that snapshot with you because I really think about that physician's words, family takes care of family. You know, we spend many hours together at work. It is like our work family. And one of the gifts that we can give one another is to just enter into each other's lives, to offer compassion, to let one another know that you're not alone with whatever you're going through, because family takes care of family. And so one of the traditions that I have when I'm ending a session like this is, and I know it looks maybe a little odd, but I just invite you to put your hands up and just give a compassionate high 10 to someone. Yes, a compassionate high 10. This is a reminder that you're not alone in the boat, that we're in it together. So just thank you so much for attending this session. And I will turn it over to Dr. Goldberg.
Well, thank you all. We're open for questions and comments, and I do believe that if you raise your hand and unmute, we will hear you. Or you can put these into the Q&A, and maybe I can just get started, Bridget. If I look at some of the comments that were made, there were how much people really loved the work they did.
Mhm.
And at the same time, if I look at all the comments about the stress, the exhaustion, it's how much they hate their job. It's kind of this imbalance between loving their work and hating their job, or at least some aspects of it. So how do you think about this problem? How do we begin to look at managing workload, reducing violence, managing staff shortages?
Thank you, Dr. Goldberg. And I'll be transparent in this well-being space. One of the things that's really hard for me is that I can't fix the systemic issues happening within our organization. So when I hear of people's staffing, shortages and their schedules and the amount of administrative work in the medical record, it's really hard. And to be honest, one of the things I've had to do in this space is really just focus on these are barriers to employees' well-being, and I've had to make a list of what I can control and what I can't. And so what I can say with that is we are working in partnership. There are certain things, yes, well-being programs and interventions can help with, but it's so key to collaboratively work with our leaders. So we are working with our leaders, our human resources department, to see where are these staffing shortages and what are some practices, new policies that can help with the staffing model to bring in new staff. And so my answer to that would be is just to work in collaborative effort. If there are things outside of your scope, are there key departments within your organization that can help with policy changes and address some of the systemic issues? So Dr. Goldberg, I wish I had more answers to that question. It's very challenging.
We still have a few moments. Any other questions or?
Stephanie, please share.
Thank you so much for that, Bridget, because I struggle with that daily myself in my role. Is there's so much I can't fix that it feels like I'm rowing against that tide. But
Right.
One thing that I do find, and I'd be really glad to hear your thoughts on, is that we will frequently have leadership that gives service to the idea of well-being, but it's not able to either budget for it or provide time in the day for it within the regular work days. And it's not just them. I get that, right? We've got insurance payers, we've got legislators, we've got everything in there. How do we overcome that barrier to allow people time for the access to the things that they need to make them whole?
Yes, thank you. Well, first of all, thank you for sharing that I'm not alone in that struggle. It is like swimming upstream sometime, and I do see in the chat others are struggling with that, the systemic issues and separating what we can and cannot control. As far as the question on just observing people don't even have time for their well-being, and again, we are experiencing that at Mayo Clinic. So it has been working with HR and departments, and what are some department patient targets, and goals, can those be looked at so that employees have a little more space in their day to attend well-being. The other part of that solution for us has been looking at where can we integrate well-being into their workday. So it could be during their grand rounds that we know that they're going to have time off to attend, having those well-being topics. Schwartz rounds during grand rounds has been really helpful solution as well, going into their work units, into their cafeterias, into their departments to just offer, even if it's a 15-minute little well-being presentation or meditation has been helpful. I will say that's part of the solution. Again, systemic issues need to be addressed at a higher level within our organization as well at Mayo Clinic.
Thank you.
Yeah, thank you.
Other comments? Questions? So if I may again, the programs you outlined is terrific. And for those who don't know, Mayo Clinic has been a leader in physician and workforce well-being since before COVID and before the current problems, with many of their classic articles written in the end of the 1900s and into the early 2000s. So refer to that. One of the principles seemed to be to make sure we're getting the opinion of the front line, and develop this with the front line, those who are doing the work. One of the dangers of that is that they put all the energy into offering solutions and giving their voice, but the voice goes unanswered. How do you have any advice about how to have leadership listen, respond, and do something about it?
Thank you, Dr. Goldberg. You actually just brought up a best practice that is so important to implement. And it is that when we do our focus groups or our listening sessions or our surveys, that we respond to those. This is what we heard and this is what we're implementing. So as far as like when we've conducted our new wellbeing strategy, we collected all the data and then we sent out mass communications in a variety of different ways of this is what we heard. And yes, it's important to come from leadership as well. So just encourage that best practice, that once we hear our colleagues' voices, that we let them know we've heard them, we see them, and then these are the action steps being taken.
Other thoughts? I mean, personally, I love this one-on-one conversation with Preacher, but it would be nice to hear what other felt while listening and any thoughts that come to mind. Sharon.
So I hear what you say, Bridget, and that is how the administration tries to act here. But I'm at the bottom level, and it oftentimes is interpreted as you say you hear me, but none of us are involved in the decisions you're making the changes with. So it still feels like they're not heard.
Yes. So at your organization, you do not feel heard or seen. Right now, just validate that. And I can see that in your eyes, Sharon.
Yeah. Well, not necessarily me, but I am in the middle and I'm also at the end of my career, not the beginning.
Yeah.
And it's easier for me to speak out than it is for new young staff. And it's hard to figure out how to help them know their voice can really be heard when they don't feel like that. And then because it's such a business these days, and the staffing level is never good compared to the medicine I know, they feel like they're defeated before they become really experienced.
I've seen lots of head nods, so you're not alone in that experience at your organization. Yes, thank you for sharing, Sharon. Mhm.
And thanks again for telling us your story. That must be really hard to share.
Yeah.
Um,
Thanks, Sharon.
Stephanie?
Sorry, don't want to dominate the conversation, but another issue that we run into with wellness that I'd be interested in your perspective is generational. The expectations between the generations, because my new out of residency providers or just graduated advanced practitioners have a very, very different sense of their own wellness than my end of career folks. And reconciling those together, particularly because the people who are generally the decision makers in our organization are more at late to end of career people, is really challenging. So I was wondering how you deal with that.
Excellent question. To think about tailored resources even by generation. So we experience the same thing. So conducting focus groups at different generations to better understand their needs. And we're experiencing that too. So one of the solutions is better understanding those generations and what are the solutions, the resources that best support them. Is that something currently that you're doing in your organization, or what are you observing?
What we're trying to, it's how to allocate resources across large systems.
Yes.
When you have such different needs, you know, I could probably name 4 generations at this point that are currently practicing medicine that we support. And is that a cafeteria? I don't even know what it looks like. I'm just interested in how other people are addressing those issues.
So
Yes.
I hate to end on a question that remains unanswered. And however,
Perfectly fine.
it is time, and we have left in this program, and you may have noticed, very short breaks between. And so I'm afraid we have to close now. Personally, I loved this presentation, and I think I speak for many who were able to participate with you. We appreciate your time. Thank you for audience participation. And we'll take a quick 15-minute break, and then please refer to the attendee hub and select the link to join in your next breakout session. Bridget, thank you very
Thank
very
you.
much.
Yes, thank you, everyone. Yeah, thank you. Yeah, take care. Oh, thanks, Sharon.